Zila checks her 9-month-old daughter Mariama's mid-upper arm circumference. She's examining her for malnutrition. After 3 of her children died due to malnourishment, the threat of losing Mariama is real and terrifying. Mariama's bracelet hits the yellow mark, which means she is malnourished. Zila knows she now has to take her daughter to the health center in Dogo, a 2-hour walk from her home. Malnutrition has turned into a national crisis in Niger. Dogo in the Zinda region is one of the areas in which the innovative project has been piloted. The health center in Dogo covers 49 villages and more than 37,000 individuals. To date, UNICEF has provided 20,000 bracelets to mothers who are proven to be powerful allies in the fight against persistent malnutrition. Zila's neighbor Zoe also screened her 3-year-old son Sofiane at home. He was found to be in a critical state. Sofiane had been suffering from repeated bouts of acute malnutrition and needed to be hospitalized. The staff at the hospital treated him and suggested ways that Zoe can feed her children better. Sofiane is now learning to walk again, and his mother has finally recovered the smile she had long lost. Meanwhile, an estimated 50,000 returnees and refugees have settled in an isolated tip in southeastern Chad known as Tissé. This area is a militarized zone, a buffer against cross-border banditry from neighboring Sudan and the Central African Republic. It's also a semi-arid area, and the large and sudden population influx seen in the past year has created conditions for an epidemiological catastrophe. There is no road with year-round access connecting Tissé to the rest of Chad, and humanitarian aid vehicles face an 11-hour overland journey to get here. Along with a geographical challenge, the semi-arid area is a breeding ground for disease. Staff nurse Nage, who has been transferred to Kele thanks to an agreement between UNICEF and the Chadian government, explains that vaccination is a priority.
Some of the mothers come without vaccination cards. They tell us their card was burnt. They fled in a hurry. So I have to check the children for vaccination scars to work out what they need.
Chad is one of the hottest and one of the least developed countries in the world. Health centers are few and far between, and only 1/3 of them have the right equipment to maintain a cooling equipment necessary for storing, managing and transporting vaccines. As a result, only about 1 in 5 Chadian children under the age of 12 months is fully immunized.
Even before we start taking into account the needs of refugees and returnees, we face a considerable challenge to reach simply Chadian children. Chad is an extremely large country, and the east is the zone with the least coverage.
UNICEF is working with the government to take more vaccines to more children in every corner of Chad. One regional cold store has already been built in Abeche, and a further 3 regional ones are in the making. This will eventually plug into a network linking the country's 72 districts and ultimately its 1,000 health centers. Along with introducing new technology, the initiative aims to reach remote communities more effectively with information about the importance of vaccination. Health staff travel to remote villages where they collaborate with community health workers to immunize children, screen for malnutrition, and educate people about how to prevent diseases like malaria and diarrhea.